The broadcast is now starting. All attendees are in listen-only mode.
Welcome, everybody, to Tuesday, July 9th, 2019. I'm Pat Hennessy. We're fortunate today to have the opportunity to spend a little time with you as we get ready for our fourth quarter. Today is going to be an opportunity to really share with you how are we going to increase efficiency, increase effectiveness, and increase profitability for your agencies. First of all, we wanted to put a shout out to the U.S. Women's World Cup team on an amazing victory, so congratulations to them. And our goal today, as we talk about process, is to make sure you don't end up like that I Love Lucy, where the chocolates on the conveyor belt come down and they come a little faster than anyone can handle. The process, because it's going to be like that as we enter this fourth quarter, the pace that you're working at now will increase dramatically. As we know, the majority of the renewals come in the fourth quarter in January. And so this is really our busy season, as everyone knows. And so the point today is to how can we figure out the most efficient way of getting the work done, because we know the volume is going to increase, and how can we at Beere&Purves be a resource for you to basically outsource where it makes sense to free up your internal capacity to get things done. So as we go through that, just want to let you know all the information today is going to be sent to you via email, so you can relax, take notes if you like, but again, don't worry about capturing everything because it's all going to be sent to you. And then if there's any questions you have on the presentation, please put it in the comment section, and then I will do my best to respond to all those questions either during the presentation or at the end. So thank you so much. So let's go ahead and get started. So what we're going to do, this is our agenda today. We're going to talk about Anthem Blue Cross Large Group, and Beere&Purves was very fortunate to have a contract now established with Anthem for 101 to 300 lives. So anytime you have a large group prospect between that strike zone of 101 to 300, please let us know, because we have the ability to now to get you a large group quote, composite rates, get that turned around very quickly. And we're going to talk about more than that in just a moment, but it's a great opportunity to, again, free up your capacity to get that done in a very efficient manner. We're going to talk about carrier highlights, and just want to let you know the fourth quarter rates are starting to trickle out for small group. Anthem Blue Cross is supposed to be released today. United Healthcare has already been released. We're going to talk about that in our rate availability. And then the Q4 tools and resources. This is really important for you to understand what is available, because a lot of the requests you're going to be getting throughout this third and fourth quarter are going to be time consuming sometimes. We do have a number of tools that have the answers readily available, so we're just going to show you where all of that information is and the resources at the very end to see where it makes sense to provide that support to your team, so you're not doing everything yourself. So let's talk about our Anthem large group. And again, as was mentioned, this is 101 to 300. So this is anytime you have groups that fall into this category, please let us know. Heather Lewis is the primary contact for these. And the nice thing is all of your existing benefits, your commissions, your broker bonuses, all of that remains the same. What we provide, and by going through us, what do you get in addition to that? So we're going to give you $2.50 per employee per month ongoing. So that's in addition to what you're already getting from the carrier. And that is going to, again, increase profitability for your agency for any of those groups that are over 100. You can use that money for online enrollments, for COBRA, for FSA, whatever that employer is asking of you, as long as it benefits them. That's what that money's for. We pay the $250 for the Kaiser enrollees. If you have a group that's all Anthem, then actually reimbursement goes up to $4 per employee per month for all those services. So what happens with these groups, there is a 5,500, which is the transparency, which shows the amount of commission being paid to you as brokers. We as a GA, we show up on that 5,500 for groups that are over 100. There is no 5,500 for small group. So the conversation doesn't exist. But they're going to ask, wait a minute, who is Beere&Purves and what's going on here? And the reason we're paying that $4 is to make sure that you understand that there's value by having us involved with that, to make sure that that conversation can be had in an honest manner. But again, they realize there's an enormous value at the same time. So that's what's happening. We're taking groups right now. They are quoting 4 months out. So if your effective date is 4 months out, please let us know. So we're quoting now out through 12/1. And then if you do go ahead and need it beyond that, just let us know. We will put that in the queue to get it quoted once those rates are available. Just want to let you know, in January, the plan designs change, so that's why they can't quote January yet. All those plan designs are still being put together. Let's talk about the Q3 highlights. And again, not every carrier is going to be really competitive here going into this third quarter. And again, we're talking about everything. This is 7/1, 8/1, 9/1. And again, the fourth quarter rates, as soon as they all come out, we'll have all of this information summarized for you. And we'll have a revised version of this for the fourth quarter carrier highlights. But in the meantime, for 7/1, 8/1, 9/1, Aetna, it's really important that you understand what's happening with them is they are competitive in this bronze arena. This is the 6,000 plan. And in certain areas, like in Contra Costa, they are 10% below anyone else if you're looking at just a catastrophic plan, where they're simply looking for, in this case, a bronze plan. Aetna is going to be your go-to carrier in that situation. In the past, Aetna was very militant about making sure that all of their business came in by the 20th of the month, because they wanted to make sure that there was no overlap into the following month and trying to retroactively do claims and all of this. What happened is, as we all know in this industry, it's very difficult to get everything in the door by the 20th of the month. So they realized that that wasn't a realistic solution, and a lot of business was being rolled to the following month, and other carriers were actually getting the business. So what they've done is they've eased up on their stringent 20th of the month and now have made it the 1st of the month. So as long as the new business is in by the 1st of the month, you can have Aetna. If it's not, then it will roll to the following month. And again, these are really critical when we talk about 12/1s rolling to 1/1, because there are benefit changes and there are rate changes in most cases. A lot of the carriers are struggling now because we are experiencing a stagnant marketplace. So there's not a lot of movement. Right now, a lot of the brokers are doing a great job. So on a service side, we're not seeing any significant gaps. And on the rate side, as always has been the case, the rates are the rates. So in that case, when there's not a lot of movement, how do carriers generate business? The way they do it is to provide a little loosen up on the underwriting guidelines. And so we're watching as the carriers, Aetna and others, as we'll talk about in just a minute, are now saying no DE9C, prior carrier bill required for 6+ enrolling. So if you have groups that are 6 or more enrolling, we don't need to show the DE9C or prior carrier bill. All we need to do is get the employee apps, the employer apps, and the check, and off we go. And so that's a new change for Aetna. Also, the participation alongside a Kaiser has been loosened up as well. So participation, all you need is 25% minimum or 5 enrolled. And again, individual coverage is a valid waiver. So it's really hard not to meet these participation guidelines unless you're in a situation where the group simply doesn't have, the employees don't have coverage at all. So let's move on to Anthem Blue Cross. So Anthem, I don't know how many of you have ever used this Live Health Online. I've actually used it personally, and it is remarkable. So we are experiencing a shortage of doctors here in the United States, and as we have 76 million baby boomers born between 1946 and 1964, the need for medical care is going to escalate quickly. You're going to see doctors and urgent care centers pop up in Target, in Safeway, to keep up with demand of healthcare. And the goal is to keep people out of the face-to-face visits with the doctors when it doesn't warrant it. So if we had a situation with my son, he had trouble swallowing, and so we basically went Live Health Online. There was 10 doctors available. We clicked on one, sent a picture of what was going on, and the doctor came on the line. So your cell phone screen is split in half. The doctor will be on the top, you'll be on the bottom, and you're communicating with a doctor that's got a headset on, which is kind of unique. He looks like a pilot, but he'll actually take you through the steps. And in our case, he actually had us go back into the bathroom where the lighting was better, and he was able to see exactly what was going on. It was kind of awkward just putting the cell phone in my son's mouth so he could look at it, but he figured it out. He basically sent a prescription to CVS, and we were able to pick it up within the hour. Very efficient way, Live Health Online. A lot of brokers, when you have the open enrollment meetings, we're racing through the benefits. We never really get to things like Live Health Online and making sure that employees understand this is an excellent way to save an enormous amount of time and get the doctor visits taken care of. The first 3 visits are free if you're except for those on an HSA plan, and the EAP, you get 2 free visits per incident. A lot of times EAP is being overlooked. EAP, we're all under enormous stress. Look at the commute times increasing. The demands as we're heading into the 4th quarter are going to be significant. Employee assistance programs are going to become a more and more critical for our day-to-day going forward, and having 2 free visits if we have financial issues, if we're having a death in the family, is going to be really important. And a lot of people don't even know that this exists. So for those that are on Anthem, there's 2 free visits to an EAP. So please take advantage of that if you need it, and let your employees know for the groups that is available also. Promotions through September 15th. As we talked about with Aetna, we said that the prior carrier bill, with Anthem, you do need to show a prior carrier bill in lieu of the DE9C. With Aetna, you don't. So as long as I have 7 on another carrier, I can give that to Anthem Blue Cross, and then I can move forward and move the group over to the Anthem. Now, if I do need 25% participation, minimum 5 enrolled, and then you'll notice if I have 4 or fewer, it's 65%. Individual coverage on and off exchange is valid. We ran into a scenario a few weeks ago where there is a healthcare plan. It's called the Christian Association. So if we all are of a similar faith and we pool our resources together, we can go ahead and have health insurance coverage. The problem is we had the executives that we were writing basically this coverage, and we submitted it to Anthem, and they said, wait a minute, these are not valid waivers. So the group blew up in underwriting because they were on a healthcare plan that is not deemed a valid health plan. So when you do see these associations, religious associations, please be careful, because some of the carriers, specifically Anthem, do not view them as valid coverage, and will create a problem in underwriting. So let us know in advance if you see something out of the ordinary, and we can let you know immediately if that's going to create an issue for you. But for the most part, individual coverage and exchange are valid, and makes it very simple to meet participation if that is your case. The one thing that Anthem is unique is this full and select HMO. So you can write a full and select HMO, but you cannot have a full and narrow PPO. And so what's happening is there is a priority select HMO. That's typically the narrower HMO network down in Southern California, but you cannot have a full and narrow PPO. So please keep that in mind. We had a broker who put the select as the base plan, and they can buy up to the full PPO. You cannot do that with Anthem Blue Cross. So you can only pick one or the other. And just for everyone's knowledge, when we're talking about the select PPO, the select does not include Sutter. In the Bay Area that we live in, Sutter is huge. Sutter is very expensive, and that is why when we look at the full versus the narrow, which is the prudent buyer full network Anthem, versus the select, which is the PPO, the key difference is that Sutter does not exist in the select PPO plans. So please be careful. Anytime you have your executive team that's looking to make a carrier change, one of the services that we are using now internally, we have a gentleman here that looks up all of the medications, all of the doctors, and all of the hospitals that the executive team is currently on, and anybody for that matter. And when we move them over to another carrier, we will do a side-by-side comparison and letting them know, if you're on this medication, it's covered as a tier 1 currently. When you move carriers, it's going to be a tier 3. That medication, unfortunately, will not be covered at all, and that doctor is not in the network. And we give this information to the group before we switch plans, just to make sure, are we going to be okay? Last year in December, we had 2 groups that we had moved over. Then the executive team realized that they were having issues with medications and doctors, and we had to actually pull the plug and go back to the old carrier, because they did not realize that how the medications and the doctors are going to be covered under the new carrier. So just because the premium maybe will go ahead and drop by 8 to 10%, please make sure you also take into fact that the formularies are getting narrower, the medical groups are getting narrower, and so we have to make sure that we look at that to make sure there's no issues when we actually make the change. The other thing we want to talk about is Pro Clear aligners. So right now, if I take my kid to go get braces, it's about $6,000 for braces. If I use Pro Clear aligners, which is teeth straightening, and I use Anthem Blue Cross, it's going to be $1,500 to $1,800. A lot of people don't understand that this Pro Clear aligners is even available as a special discount simply by having Anthem Blue Cross. So please make sure that those that are on Anthem are aware that this benefit exists. It's a significant benefit for those that need teeth straightening. And unfortunately, a lot of employees simply are unaware of this benefit. The other thing that we're experiencing is as families are waiting longer to start families, what we're finding is that infertility is becoming a big issue with today's younger folks. And so what's happening is the cost to go through infertility treatments, I'm sure a lot of you are aware, anywhere between $15,000 and $30,000. Winfertility is a discounted service for those that are seeking infertility treatments, and it's a significant discount off of the traditional infertility treatments. When we look at medical care, oftentimes the infertility treatment may only be up to $2,000, and oftentimes it's very selective on what it actually covers. It may diagnose a problem, but it may not treat a problem. And that's really where winfertility comes into play, to provide employees with an alternative to save some money if infertility is a situation that they're challenged with. The other thing that we're seeing is on dental. Oftentimes medical carriers are not viewed the same as ancillary carriers. So for example, if I have my Anthem, a lot of carriers will go ahead, or a lot of groups think, okay, well, I need to put my Delta Dental in place and I need to put my DSP in place, and overlook the fact that Anthem Blue Cross and all the other carriers that we're going to talk about here have a very robust ancillary lines network. And so what we're doing is, and what we're seeing is, for groups that are 10 and under, it makes sense to bundle it with the same medical carrier. It's one bill, it's very efficient, and the coverage and the benefits are significantly enhanced to what a lot of people are thinking about. In this example, when we look at dental with Anthem, they cover implants, they cover the posterior composite fillings, and the big thing is, if my dentist is an out-of-network dentist, I get 90% UCR, which is huge. And so I would encourage you to at least consider quoting the ancillary lines through the existing medical carrier, as well as the other traditional carriers that you're looking at, because you may be very pleasantly surprised how competitive it is, and the fact that when you bundle it together, there's a lot of savings that can be had as well. Then last thing is vision. So vision benefits, they reset every January in life, and the life insurance will match at 10 or more. So if you do have life insurance, let Anthem know and they can go ahead and match that for you. Moving on. So let's talk about California Choice. California Choice has become very popular. The nice thing about them is that the Anthem Blue Cross, their full network HMO, is going to be effective in September 2019. You do have 3-tier options now. You can have the silver, gold, platinum. You cannot have bronze, silver, gold. So please be careful of that. If you're going to give a bronze plan within Cal Choice, you can only have bronze and silver options. If you start with silver, you can have the triple option, the silver, gold, platinum. The other thing that's big is that there were some significant late fees that were being assessed for those that were late with their payments for the premium. The nice thing is Cal Choice has done away with that. They've increased their administrative fees $5, so let's say it's $30 a month to have California Choice, so just be mindful of that. But the late fees have been removed, so therefore those significant bills, which could be as high as 10% of the premium, are no longer going to be assessed, which is nice. Covered California is a carrier that we are seeing significant an uptick in the business, and the reason for that is the majority of the business, 50% or more, is Kaiser Direct. And so if I'm on a Kaiser Direct plan, I'm going to ask you as a broker, is there anything less expensive than Kaiser? And most brokers will say, no, Kaiser is the most competitive plan on the market today. But what if I told you can get Kaiser cheaper? And that's what some brokers are doing. They're taking Kaiser Direct plans and they're moving them to Covered California for a couple of very good reasons. Number one is that I can move Kaiser Direct to Covered California off anniversary. I cannot go Kaiser Direct to Cal Choice off anniversary. And that's a big exclamation point I just want to make sure everyone's aware of. We had A broker tried to do that, and unfortunately we're not aware that you cannot move from Kaiser Direct to CalChoice only at anniversary. In this example, it was 12/1. They were trying to move a 12/1 group to 8/1, and we ended up moving them over to Covered California. Why are the Kaiser rates cheaper in Covered California? It is because the pediatric dental does not exist in Kaiser in Covered California. Pediatric dental is $14 per child. If I have 3 children, I pay $14 a month times 3 times 12 months out of my pocket for a benefit that I don't even use. And so if I'm looking for a cheaper option to Kaiser, can you please quote me Covered California, and that will provide a typically a 2% lower rate for those people with families. The other thing that's interesting is, why does it make sense to go to Covered California, is that the executive team typically likes to have the ability to send their kids to UCSF or to Stanford. When you have Kaiser, obviously those facilities are not available to you. As the owner of the company, I'm writing 100% of this off as a business expense anyway. I want the best for my family, and this is what we're seeing in a couple of examples that we recently did. So when they have the ability to go to Blue Shield and can go ahead and do that, and the rest of the employees can go to Kaiser, it's a good fit. And the other thing is, right now we have an unemployment rate of 4% here in the U.S. and specifically in the Bay Area. It is getting harder and harder to find good people and to bring them to companies and to attract and retain. If I have an employee that happens to have a sick kid or a sick spouse, I cannot bring them to my company by offering Kaiser Direct, because if they need to see a specialist at Stanford or UCSF, they do not have access to that. So it does make sense to increase your ability to attract and retain by offering Blue Shield and Kaiser. It does make sense because your Kaiser is going to be cheaper, and overall you're going to have a better program. Now, a lot of people are very concerned with Covered California. They've had some issues in the past where there's been some service issues and some commission paying issues. We have signed our contract with Covered California as of October last year, and we have been very happy with the service levels. They do take a little longer than the other traditional carriers, but again, it's significantly shorter because we use ease for all the enrollments and transporting that information over to Covered California for processing. So please keep that in mind. Oftentimes when you see your Kaiser renewals as they're coming up, a lot of folks will just renew with Kaiser, move on, and not even offer Covered California. I want to make sure nobody loses a broker of record letter because you didn't at least offer a cheaper Kaiser option where it makes sense. For those of you that are not on, there's no administrative fees either. So I'm not paying $30 a month to have a group like I would with CalChoice. There's no admin fees with Covered California, which saves me $30 times 12, $360 as well. The new broker portal is now available, which was another hindrance that was creating some issues for brokers. Now that's available, so now you can access the information on the website. And the last item there is, if you are not certified with Covered California, the issue was it would take an 8-hour class to go ahead and get certification done, which is a big pain, and nobody has time for that. Right now, all you need is a 1-hour class. I have the link that I can send over to you. You don't even take a test. You click through the slides, read the information, and you are certified once you pay your fee associated with that. So that's really helpful. So please make sure that you do include Covered California in your marketing and in your prospecting for 2019 and beyond. The next one is HealthNet. HealthNet, unfortunately, we've seen them struggle here in Northern California. They are dominant down in Southern California with the narrow networks. So we are in Northern California, they do have the 6 or more enrolled. The HMO only, as long they don't need the DE9C, prior carrier bill or participation form. Basically, if you're on an HMO with HealthNet and you're 6 or more, just give them a check in the apps and you're done. So that's another one that's become very competitive when it comes to the underwriting. As we move on, the next one is United Healthcare. United Healthcare has positioned themselves very well as we're going to enter this 3rd and 4th quarter. A couple of things. I know we receive a number of, not complaints, but concerns regarding the portfolio and how it's so confusing. And so we want to let you know there are 6 portfolios, And when you look at the employer application, you'll notice that they're all in columns, and you can only have plans that are in that column that are being offered. You can pick one column, which are called their portfolios, and that can be offered to the group. You cannot have a plan that's not inside of that portfolio. We would encourage that you use Choice Simplified. It's going to be 4 and 5. They have the richest PPO plan designs. And they also offer what's called Primary Advantage. Primary Advantage is what we call the millennial product. The reason we call it that is because there is no cost to go to your doctor. The cost for the medications is either $0 or $5. Urgent care is $50. And the out-of-pocket max is lower. And so when you look at gold plans, and this is both in the HMO and the PPO within United Healthcare, versus the Primary Advantage versus a traditional gold plan with the same deductible, you'll see about an 8% lower rate. The reason you're seeing that lower rate is because the coinsurance, once you get above that $1,250 deductible, is going to be 30% under the Primary Advantage, and it's going to be 20% under the traditional gold plan. Now, the out-of-pocket max under the Primary Advantage is $5,600. The traditional out-of-pocket maxes are $6,000 or $7,000. So when you're quoting the plans, please keep Primary Advantage in mind. It does make a lot of sense, and it's a lower cost, and it's got a lower out-of-pocket maximum. So please make sure that's included when you do your marketing. Harmony is something you're going to hear about, but that's really in LA, so you don't need to worry about that. And then when we talk about alongside Kaiser, more and more groups are loading up on Kaiser. When we have a situation where the employees are going to be offered bronze and the management team wants to take platinum, you can't do that with Covered California. But if you do it with Kaiser Direct and United Healthcare, as long as those 5 are in California, you can do it. And if you have folks living out of state, the United Healthcare is the most competitive when it comes to out-of-state plans. So if you have any questions on that, please let me know. We can walk you through it. But they are the most friendly alongside at Kaiser. But I would say if you have 1 or 2 with Kaiser, why wouldn't you go with Covered California? But if you need to have, you don't have that adjacent metallic tier issue, or if you do have that issue, then you have to go to a Kaiser Direct and a UHC scenario if the plans being offered are not next to each other. Covered California, you can only have 2 adjacent metallic tiers. Cal Choice, you can have 3 if you start at silver. If you go Kaiser Direct with United Healthcare, you don't have to worry about the adjacent tier, metallic tier issue. Startups. With this economy booming, we are starting to see more startups, which is very healthy. It's good to see new businesses come in. And there's a lot of competition amongst the carriers for these new startup companies. So they're making the requirements fairly easy for them. So with United Healthcare, for example, all you need is 2 weeks prior carrier, 2 weeks payroll prior to the effective date, and you're all set. In the past, we used to need 50% of the previous calendar quarter. We don't need those requirements anymore. Everyone's become very friendly when it comes to these new startup companies. And then lastly here is motion. If I go ahead and have, if I'm on an HSA plan with United Healthcare, I can earn up to $3 per day. If I have my intensity and the frequency and ongoing, basically movement throughout the day, I can earn up to $3 a day if I hit certain goals. So that's something that's also the future of healthcare, is to incentivize people to move, and this is definitely one way of doing it. Let's talk about rate availability for the 4th quarter. So what we're going to do is we go down here, you'll notice that for example, with Aetna, the 10-1 rates are in-house. Those are going to be released on 7/15. Anthem Blue Cross, they're going to be released today. Shield is going to be on the 11th. Cal Choice, we have the 9/1 rates in-house. They have not told us what's going to happen yet because HealthNet had to refile the rates, which is delaying Cal Choice. So that's why that one has been on hold. CCHP, you notice that those rates are live. Covered California, we have not received their release date yet. HealthNet, you'll notice there that we have those rates, but we haven't been told when we can release them. Kaiser's good through the the 7-1 rates are going to be good through the end of the year. So that's why when we talk about processing here at the beginning, most brokers will go ahead and try to get their Kaiser renewals done now because the rates are live. And as we mentioned, most people are just going to stay with Kaiser. But the covered California rates haven't been released yet. So you may want to let them know, hey, I know we don't want to touch a group twice, and that's something that I'm very conscious of. But let them know if there's any issues or if they need a non-Kaiser option, that covered California could be helpful down the road. Those rates are not available yet. And then you'll see that United Healthcare, those are the 10-1 rates are live now. So that's those, you can be quoting those all the way through the end of the year. So if you have any questions on this, let me know. And as I mentioned, these are going to be sent to you later today. Let's move on to East Central and ongoing maintenance. A couple of years ago, we had 5% of our groups going online. Then it was 10. Now it's 15. We are starting to see a steady increase in the amount of groups that are going to Ease going forward. And I think that is the future of our industry. And so a lot of brokers are requiring groups or highly encouraging groups to get rid of the paper and go to an online enrollment and to adopt Ease as their platform for all ads, deletes, and maintaining all that employee information. The one thing that we do a couple things here. Step one is that if you don't have an Ease account, we'll go ahead and get you set up on Ease and do the online enrollment for you. Because you don't have the online account set up, we can't do the ongoing maintenance. So the ads or deletes 3 months down the road, we can either set them up to go directly into the carrier portal, and we do training on that, or they can fill out the paper app and send it to us, and we'll get that processed for you. For those that have an Ease account, we will set up the initial enrollment. We will also do the ongoing maintenance. And what does that mean? That means that we set up the group for an 8-1. We basically go ahead and get all the carrier documents electronically sent to the carriers for processing. 3 months later, there's a new hire. We're going to let you know, Mr. or Mrs. Broker, we just received a new hire application for ABC Company. We've sent that over for Anthem for processing. And then 3 days later, if it's processed, we'll just send you a note back saying, hey, we just want to let you know they're in the system and you're all set. So we are monitoring accounts every single day for a number of brokers currently. This saves an enormous amount of capacity internally and freeing up resources for somebody to have to do that. We take full responsibility to make sure that these are done properly and maintained, and that you are informed when a change is made. Now, the two carriers that we do not have currently available are Blue Shield and Kaiser. So you may say, well, what happens if we have one of those groups? So let's say we have United Healthcare and Kaiser Direct. So we will, because we have United, we'll take those apps, forward those to Anthem for processing, forward those to United Healthcare for processing. With the Kaiser applications, we will grab those applications and we will send them to you, advising you that, hey, we just want to let you know we have these. We send them to you for the forwarding to the carrier. So at least it was captured, and you're only having to forward the information that's already collected. You're not having to go ahead and check the account every day and filter through all the accounts to see what and where there has been activity that needs to be processed. So that's helpful. Ryan Moore is our Ease czar here in the office. If you have any questions on how that works, if you want to see a demo, please let us know. We'll be happy to do that for you. But this is the way of the future. We are slowly heading out of the paper world. I don't think we'll ever get out of the paper here in our insurance industry, but I do think it's trending in that way. You want to embrace the online technology because it's not going away, and anything we can do to help you, please let us know. Broker picks, what this is making sure as a partner, we're going to go ahead and reimburse you for the expenses that you are incurring to bring on a new piece of business. So for example, I just mentioned Ease. If we write a 30-life group with you on Ease Central, and if you have an account with Ease, we're going to pay $1.40 per employee per month. What does that mean? So that means that for that 30-life group, we're going to pay $1.40 for each body, times 12. That's $504. That is a payment to Ease that reduces your monthly subscription cost. So that is basically reducing your expenses, increasing the profitability to your agency. If you do not have an Ease account, and it's a 30-life group, we will go ahead and pay for any of the items that you see here. If it's 5 to 19, you'll notice here as well. We can do HR 360 for the first year annual fee, or we can also put together for COBRA the first year annual fee. And again, the whole point of this, we understand that you're constantly being asked to pay more and more for your groups, and we want to partner with you and provide that resource for you. So please take advantage of this. Any groups that we write with you, we want to make sure that you are reimbursed for the expenses that you're incurring along the way. Now let's talk about resources. So we talked a lot about what's going on in the industry, but what are the resources that you can use to increase efficiency and save time as you're entering this busy time? So let's look at one. So for example, this is competitive PPO plans by county. So let's go ahead and open this up. Let's see. And here we go. So let's say my employer is located in Contra Costa County and we have a renewal coming up at 9/1. And let's say they're on HealthNet, just picking any provider here. And I know that they're currently on a Gold 1000 plan. So if I look at this, I'm in Contra Costa County, Area 5, where that employer is located. I look at the Gold 1000. This shows me that Anthem Blue Cross has the most competitive Gold 1000 plan of any carrier that's a PPO in the industry. So I know immediately if I'm already on the Gold PPO plan with Anthem, then I'm on the most competitive plan available. So I'm good, unless they want to look at a Kaiser option. So this is a great tool to help you triage quickly to let you know, am I currently with the lowest cost provider based on the plan being offered? You'll notice that if I'm going to go to a silver plan, I may look at this United Healthcare. And as we talked about, if I go to this bronze HSA, I should be looking at Aetna. The other thing you'll notice here is that the parentheses has a percentage sign in it. This shows you, for example, with Aetna, Aetna is 10.59% lower than the next closest bronze HSA carrier. So that means that if I'm not on this bronze HSA or with a different carrier, I may want to look at going to Aetna because that's a 10% difference. Some of the others, you'll look at this Gold, for example, it's the next most competitive carrier is only 1.43% higher. Are we going to move a group for 1.43%? Probably not. So this tells you what the next most competitive carrier looks like. So this is a great tool to very quickly triage where we are. Do we have the most competitive PPO plan in place? Does it make sense to move them, yes or no? We go back to our slides. Most competitive, let's look at year-over-year rate increase. You're going to get these questions asked a lot by your existing groups. So let's look at Area 5, Contra Costa, for example. And if I know that I'm on, let's say with Anthem, I'm on this Gold HMO, the rates went down. Q4 2017 to Q4 2018, 9.9%. And we're going to update this as soon as we get our Q4 rates coming up here. But this tells you what the rates have done year over year based on the most competitive, based on the most popular plans that we've sold. And this just gives you an idea. So if you need this, we can definitely help send this over to you as well. Everything you get in the proposal today have these hot links included. So you're just going to go ahead and click on them, and that's how you'll be able to open these up. Deductible accruals. Do I get deductible credit, yes or no? And how is the deductible? Is it embedded? Is it aggregate? How does it work? This is the deductible style, where it's not applicable. So typically, there's no deductible. Embedded, this is one of the things you have to understand is when you explain an embedded deductible to your average employee, they have no idea what you're talking about. Then embedded deductible means that each employee's deductible will count towards the family, but an individual will not be more responsible for paying more than their individual deductible. So if the deductible is $2,000 for individual, $4,000 for family, that one individual will never pay more than $2,000, but it will apply towards the family deductible. That is how all of these deductibles are set up. So if you ever get asked that question, please make sure that you explain it to them, that they understand what that means. Now, if I go out of network, does that expense, the out of network, does that count towards my deductible? And in a lot of cases, it is separate. So you have two silos. You have a deductible for in-network, you have a deductible for out of network. That's why it is so critical to stay in network, because you're now using money to try to build up in two different buckets versus keeping all of your expenses in network, and therefore all those expenses accrue towards an in-network deductible. The next one here is life plans. So as you're quoting, and let's say we know that the employer is on a PPO 750 deductible. So we click on that. So here you'll notice at the very bottom, this is my 750 deductible. These are the carriers across the top. So this represents all of the plans that are in that same strike zone. So if I know that they're with the Blue Shield PPO 750, I would quote with Anthem, the 3750 20%. Everything in this row is what I would be quoting. Now you can do this automatically within Health Connect, and that's what our quoting specialists do. But if you're looking for a visual, this is very helpful, so that way you know what other options are available. Now let's talk about, oftentimes we only want to quote full networks. The one I just showed you has full and narrow networks. This is only the full networks. So if I am quoting, and I want to keep this next to my desk, so if somebody is on the Anthem Blue Cross plan and they're on a gold PPO 20-30%, and they may ask me, what is the out-of-pocket maximum? Oh, I just come straight across. Here's the out-of-pocket maximum. It is $6,500. If I go to the doctor, it is $20 for my primary care office visit. This is your specialist. And oftentimes we say, what's the difference between a specialist and a primary care doctor? The difference is ologist. If I go to a dermatologist, anybody ending in ologist is a specialist. So that's how you're going to remember that. A primary care doctor's here at $20. Dermatologist, rheumatologist is $50. Inpatient hospital, 30% coinsurance. And here's your RX for generic, brand, non-brand, specialty, and then is there an RX deductible? Yes, there is. So this is a great tool we want to make sure you're aware of, so that way you have access to this. Now we want to talk about Medicare Part D. There's a lot of folks in the workforce now that are over age 65. It's really important that they are on a creditable plan for their medical benefits and pharmacy benefits. If not, there could be a problem down the road. So if I ask you, my employer, is everyone on a creditable plan? This is the spreadsheet you're going to give them, because this tells you all the plans and if they're creditable or not. What's happening here? Non-creditable. Typically, your bronze plans do not have a creditable pharmacy benefit. It is important that your employees over 65 do not go on these plan designs. They have to stay on anything with a creditable plan to avoid a penalty. So please make sure that you reference this tool as well. Portfolio and glossary. All of these terms are changing constantly. So for example, if I'm trying to figure out what is the portfolio for Aetna, it's the pickup plan. And I'm limited to 5 plan selections. A lot of people don't understand that. You can only have 5 plans within the Aetna portfolio. And if I come down here and I see something that's called the, let's look at the basic plan. What is the difference between the basic and the HMO? The HMO and the HMO basic, well, if you come to the right, the HMO is the full network, 74,000 doctors, 330 hospitals. The HMO basic, it's cheaper. The reason it's cheaper is because it's a narrow network. There's only 17,000 doctors, not 74, and there's only 197 hospitals. This is going to be really helpful as you're picking plan designs to understand the significant difference between the number of doctors and hospitals. If somebody asks you, what is the home delivery RX service that Aetna uses? You're just going to come down here. Here's your RX home delivery. It is Aetna RX. It's a mail order. Who do they use for behavioral health? Oh, they have their own. And who do they use for pediatric dental and vision? Here you go. It's all right here. Every carrier has a similar scenario. And again, we talked about Anthem Select. You'll notice that all the information is right here. The other things we want to talk about is the billing policies. Oh, actually, no. Let's talk about the, yes, the billing is next. Oftentimes you get questions. When are they going to take the money out of my account? I'm a new business. I have cash flow issues. Can you let me know if I give you a check today, how many days does it take to process the check? So for example, here, I know that the invoice is generated with Anthem on the 1st. I know my payment is due on the 1st. And I know as soon as I give you the check, it takes 2.5 days to process. That's what I need to know, so I have money transferred to that account ready to go. If I go over here within CalChoice, it's 24, 48 hours, 7 business days for HealthNet, and then 7 to 10 days for United Healthcare. I know I can float that money and hold on to it longer if I go to United Healthcare. So these are things that you're going to get asked, and at least if on a Friday night at 4 o'clock you have a group in a panic saying, I need to overnight a check quickly, who do I send it to? You're going to go ahead and reference this tool. Here's the overnight address for each of the carriers listed above. If they have a billing question, they should be calling that number. And if there's a late a reinstatement, this is the number that they need to call. This is cancellations. What is sad is that we have medical insurance is so expensive, and yet a lot of employers don't look at their bill. And there's a lot of employees that have left the company 3 months ago that they're still paying health insurance premiums for. And then they try to get it retroactively resolved and get their money back, and the carrier's like, no, you should have looked at your bill. So the carriers are cracking down on this, so please make sure you educate your groups to look at your bill. Don't be paying any premium for somebody that's not there because nobody's looking at the bill. So this tells you when we talk about canceling the plan design, where does it get sent to? What is the grace period? All of this information is here. This is for you if you ever need this to reference this information. And then we talk about installation. Our job is to manage expectations. And so when we look at this, if all of a sudden we're going to write a new group with CCSB, and I'm going to ask you, when do I get the cards? When are the cards coming to the employees? And this was an example that I give because this is a real life example. We had a situation with the broker. The HR person said, I am sick and tired of the employees coming to me saying they never got their cards. When I change carriage with you, I want you to promise me, Mr. and Mrs. Broker, can you make sure that the ID cards are sent to my office? I will personally hand out the ID cards to make sure everyone gets them. The broker said, absolutely no problem. When you look at this and it says the ID cards are delivered to, they have to go to the employee. They cannot go to the employer. The broker did not realize that the ID cards went to the employee. The group was furious. The broker actually lost a broker record letter over this simple situation where they overpromised and didn't realize that the ID cards cannot go to the employer's address. So this is a good tool for you. Please keep this in mind. Always understand ID cards are always going to be sent to that employee, not to the employer. Infertility. We talked about infertility before. We know that Anthem Blue Cross has a win fertility benefit. But what if I'm in a situation, I'm trying to figure out, I'm the owner of the company, I need to know which carrier offers the most comprehensive infertility benefit. This tool is going to provide that answer. As we look through this, it tells you exactly what's covered by each of the carriers, the amounts, if it's an HMO, PPO, or HSA. So this is a great reference tool for you, and it covers each of the carriers. And this is what you want to give that the individual to make sure they're making a very informed decision. One of the things that you'll notice is that IVF is oftentimes excluded from all these plans, so please be careful of that. Another tool here is we have this hospital network. And as I mentioned before, let's look at California Choice. This is hospitals that are HMO, PPO, and let's look at, here's Anthem Blue Cross, here's the Prudent Buyer, which is the EPO within CalChoice. Here's the Advantage, and here's the Select. You'll notice that if there is not a 1+ in this box, then you cannot have access to that facility. So if I need to send my child to Alta Bates, Berkeley, and you put me on the Select PPO, do you see a problem? Absolutely. The problem is that the Select PPO is not in network with Alta Bates, Berkeley. Anytime you see this S, that signifies that that's a Sutter facility, and that is a more expensive facility that a lot of the owners would like to send their family to. So please be careful. This is a comprehensive hospital comparison tool. You'll notice that if it is blank, you do not have access to that facility. So please be careful of that. There's also asterisks down here, which means that I have access to go to in this example, a John Muir doctor, but that doctor does not have access to admit me to that facility. They do not have admitting privileges, so please be careful of that as well. Some of the top selling plans we want to share with you quickly. These are the top selling plans year to date. So this will tell you what we are selling. And again, we're selling primarily in Northern California, a lot of it in San Francisco, a lot of it in Santa Clara counties where we have a lot of the Silicon Valley. So this just gives you an idea of where the plans are selling, most competitive plans selling year to date. Obviously, every employee is going to, or employer is going to be different. And we will move on. The partner services, this is what you're going to be looking at to figure out what can you do internally and what can be outsourced. So as you go through each of these, determine which of these can be offset to Beere&Purves and therefore freeing up capacity for you to focus on the more meaningful tasks. What we do have is a number of broker relationships where we're actually doing the initial loading of the census, and we do like plans and I downgrade, and we send the quotes back to them for final tweaking. This saves a lot of time on your end to make sure that you're not doing all of the loading of the groups into the Health Connect system. Those of you that have access to our Health Connect, you have access to that 24/7. We have 2 quoting specialists here, Tracy and Heather, that are available to do the quoting for you or to guide you through any of the issues that you may have as you're going through that process. The underwriting, we have 3 underwriters here in-house in Walnut Creek. Anytime a group is set in, it's first in, first out. You get 1 list of missing items, and you can ask any of the carriers. Our reputation in underwriting is one of the best amongst any of the GAs in existence. So everything goes in clean. The approvals come back very fast. So that just saves you a lot of time and effort. So if you need any of these resources, please take advantage of us and use those. I want to thank you for joining me today. Typically we try to keep these 45 minutes. I know we went a little long, but I wanted to go ahead and let you know we will go ahead and provide you with a copy of all the resources we went through today. If you have any questions of me, please let me know. As you know, the 4th quarter is starting very quickly here, and we want to make sure that you have a sane 4th quarter and getting these groups out as efficient as possible in a relaxed manner. So in the meantime, hope you're enjoying your holidays. Take care, and we look forward to working with you throughout the rest of the year. Have a great day. Bye-bye.